Congressman Porter, thank you very much for joining us tonight. And I'll never forget the first time I saw you question anyone in a House hearing. And I wanted to get you on this program right away at that time because it was the kind of questioning I've always dreamed about seeing. And I started to wonder then, the Washington lobbyists are going to have a lot of trouble trying to anticipate Katie Porter questions in hearings. But this time you actually told them ahead of time what you wanted to ask about. And it still seemed as though they weren't ready.
No, I've never tipped my hand like that before, but we wanted to get an answer. And so we gave the CDC every opportunity to think this through. My colleagues and I, Rosa DeLauro and Lauren Underwood, sent a letter a week ago. We gave a deadline of yesterday. And then last night, working with the staff on the Oversight Committee, my staff and I let the CDC know that we wanted an answer to this question. Having given both the question and the answer in advance, something I certainly never did as a professor, it was stunning to see someone still struggle.
Well, I'll just say from my own experience in Senate hearings when I was working there, it's often the case that you actually tell them, especially if it's the administration, you tell them ahead of time what you want to ask about because you're really hoping to get an answer. And usually when you do that, you really do get something that's clearly responsive because they knew that this was the big question that was coming. So it's a stunning thing to watch. But how do you make sure that they're really going to deliver on this?
Well, I think you have to be prepared for exactly what we had happen here, which is an effort to delay, to dither, to obfuscate with words. And the stakes really here are life and death. And so he should have come prepared to give a clear answer. If he wasn't willing to use the existing law to save lives, then he should have had an alternate plan. And still what we heard was a bunch of mumbo jumbo about operationalize and intent and continuing conversations. We need testing for every American who's symptomatic of coronavirus without regard to insurance. And we frankly needed it several weeks ago. And so I'm very glad that I was able to put the CDC director, get that answer out of him, hold his feet to the fire. And I'll tell you, I intend to continue doing that and hold him to that promise that he made today, because it wasn't a promise to me, it was a promise to the American people.
Well, yes. And after you made it very clear and said, OK, everybody, listen to what you just heard him say, you then got him to say it himself. And so you've got him right there on the record in that testimony saying, yes, we're going to do this. Now, there is some information tonight about the package Nancy Pelosi's negotiating with the administration that indicates this might actually get free testing might get written into law over and above where it's already, as you've pointed out, written into law for the CDC. So it might. Do you have any awareness of whether it'll be in the legislative package released tomorrow?
We're told that it's likely to be in the package. We spent all day today, waiting to hear and hoping to vote on that package. But I think it's really important for Americans to understand that the job here was done. A prior administration, the Obama administration, finalized this regulation, contemplating, learning from past public health emergencies. So while it's great that the House is going to take action, and the package has more in it than just free testing. It has other supports to help people. But the reality is we could have been promising people free testing regardless of insurance status long ago, using the existing law, if only the people, the officials in charge of enforcing the law, did their jobs.